Hi, I'm Dr. Shiva Ghofrany, an OBGYN since 1999, who also ironically had ovarian cancer when I was 46 years old in 2016. I want to discuss some general facts about ovarian cancer, and then I promise in the next several videos, we're going to get into all the details you need to know so that together we can stop calling ovarian cancer the silent killer. Here are some of the things that you need to know about ovarian cancer. And again, these are going to be general points because, like we talked about in the next several videos, we're going to be going over a lot more details. The risk of developing ovarian cancer increases with age, with the highest risk for women and people with ovaries being at 63 and over, though we are seeing it increasingly in younger women. Because the symptoms of ovarian cancer can be vague and easily mistaken for other conditions, we tend to diagnose it late, which is why about 2/3 of ovarian cancer cases are found at stages 3 or 4, when it's much harder to treat. The surgeries are more challenging and the chemotherapies have to be more aggressive. That's why the odds of survival, if you look at all stages of ovarian cancer, are only about 50%. That said, if we find it early at stages 1 or 2, the chances of survival are much higher, and the chemotherapies luckily do not need to be repeated frequently, if at all. Also, there's currently no screening test for ovarian cancer, and I'm going to repeat that. You are not able to be screened for ovarian cancer the way you are, for example, for cervical cancer or breast cancer, which is why the symptoms that we're going to talk about soon are so important for you to know. Genetic mutations, family history of ovarian cancer, even without a specific gene, and certain reproductive factors can actually increase your risk of ovarian cancer, but things like being on the birth control pill or having your tubes removed can decrease your risk. Typically, the treatment for ovarian cancer is surgery, followed by chemotherapy. And every year, luckily, researchers are finding more and more chemotherapies and medications to help us live longer, since it's often found later. While ovarian cancer has a high mortality rate, this is because we tend to find it at advanced stages. But when we diagnose it early, people actually tend to do very well, like in my case, where it was found at stage 2. I really want you to help yourself and use all of your doctor's understanding of the facts so that together we can all really help figure this out early where it can be fixable. So I really want you to listen up so we can go through all of the risk factors, how you can think about it, how you can find it, how you can be proactive without being paranoid, how you can partner ideally with your doctors so that both of you can work together so that we again can eliminate the late stage ovarian cancer diagnosis. Thanks for being here.